Hello everyone, I'm Dr. Darren Edwards and I'm doing a quick session on something called Acceptance and Commitment Therapy, abbreviated ACT and pronounced ACT. Just to give you a very quick overview of the historical events of clinical psychology. There was a guy called Phineas Gage. He was working on a railway line and became famous for his accident where some dynamite exploded and the part of the railway line went through the top of his head. So what the bar there, that's a part of the railway line, and you can see on the top right there, that's his skull afterwards. So it kind of went through like this. It destroyed his orbital frontal cortex. That's very, very important. It's the social brain. It labels emotions. It's very, very important for emotional kind of recognition. So it removed his depression, which is great. But it kind of removed a lot of other emotions and his ability to kind of socialize and be human. His kind of friends said he was a little bit zombie-like after the experience. So this is what happened after. It was used in clinical psychology called transorbital lobotomy, where they placed a kind of like an ice pick type device underneath the eyeball, tapped it into the brain. There we are. That's what it looks like to treat depression, mental health disorders. Another type of therapy that came along was something called psychoanalysis by someone called Sigmund Freud. This was kind of deemed as non-scientific. Just to give you a very, very quick overview, he had things like dream analysis, looking at the symbolic relations of dreams. He was looking at free association, where he'd have the patient kind of expressing themselves, talking about their trauma. And he believed kind of a lot of the problems will be in the Victorian period is that people had these really suppressed urges. It's much more complicated than that. He had stages of development and so forth, but I don't want you to talk about Freud too much. Just bearing in mind he had an important aspect in the early 1900s in terms of the evolution of psychology, but it was broadly regarded as non-scientific. So where it starts getting interesting was the very first experiments with something called Pavlov's dog experiments. It's the very first experiments with classical conditioning, where you had a Pavlov, I think he was actually studying salivation, nothing to do with psychology. He stumbled on this thing called classical conditioning by chance, and he realized that when you paired a bell, sound of a bell, ding-a-ling-a-ling, with food, the dog obviously would salivate on the sight of the food, and then when you took the food away, eventually, just the ringing of the bell, ding-a-ling-a-ling, the dog would still salivate, which he called the classical conditioning. So that's basically where you have a unconditioned stimuli turned into a conditioned stimuli. So that's the case of the bell. It was an unconditioned, neutral stimuli, and then you paired it with the food, and then it became a conditioned stimuli, and the bell led to the salivation of the dog. This was a very, very early kind of experimental study, early 1900s, and really marked the kind of beginning of experimental setups in psychology. So it's very, very important for the development of psychology. A guy called Skinner came along with his Skinner box and manipulated certain environmental conditions, where he basically found that the rat would increase behavior based on certain reinforcers. So if you gave the rat food pellets, it would do some kind of task. If you gave the rat cocaine, it would just basically keep on hitting the lever in preference for that over food and sleep, and it would basically die as a result. So it just shows how powerful reinforcers were. So Skinner kind of created a theory about operant conditioning, which was the first theory of behavioural change. How do we change an organism's behavior given certain environmental conditions, which he called positive and negative reinforcement, where positive reinforcement was some kind of pleasant stimulus or reward for a behavior, and some negative reinforcement, some kind of punisher. And the idea is negative reinforcers leads to a reduction in the behavior, frequency of behavior, and positive reinforcement leads to an increase frequency of the behavior. So just before I get on to Noam Chomsky, just to say that those practices were kind of used in aversion therapy, where they would try to provide negative stimuli to negative pairing with people who had urges, alcoholics who had urges for alcohol. They pair it with maybe electric shock, called electroconvulsive therapy, or some kind of tablets that would create very, very violent symptoms of sickness and vomiting. So again, negative reinforcers. They even used it with homosexuals in the 1950s, and when it was obviously illegal. So there was obviously major ethical issues around that. This guy is Noam Chomsky. He came along and basically said, well, this behavioral view is rather limited. It doesn't really explain the kind of how language emerges. It can't all be reinforced. There are lots of like communities that develop verbs, nouns, adjectives, and so forth, and they don't require direct reinforcement. So he basically said, he had an argument that there's some kind of language acquisition device in the brain that promoted language, as opposed to everything having to be directly reinforced. Cognitive and behavioral sciences. So just to re-emphasize, Chomsky was a cognitive psychologist. He believed there was like mental representations of language, whereas the kind of behaviorals, they don't really think about mental operations. They just are interested in explicit behaviors. The two theories kind of departed in the psychological literature, where cognitive psychology became the dominant and behavioral psychology was not so dominant anymore. It was fringe, regarded as just not good enough to explain the emergence of language. Chomsky created, or his kind of ideas led to cognitive psychology. A guy called Aaron T. Beck came along and basically tried to take elements of both theories. So he looked at the behavioral models and he looked at the cognitive model, and he said, right, okay, so that we don't know that we got these thoughts that we can perhaps alter, change. We can change these thoughts, and perhaps we can, with phobias, perhaps we can introduce things like systematic desensitization to reduce the intensity of certain phobias and OCDs and so forth through exposure. So the idea is you have like a spider, and if you've got a phobia of a spider, you basically introduce the person who has the phobia with maybe an image first, so not a really strong stimuli, just an image, and then their kind of anxiety obviously would go through the roof, and after a while they'd feel less anxious being exposed to the stimuli, and then they would be introduced to maybe a spider in a glass, and a week later, and again their anxiety would shoot up again. Within time it would slowly desensitize, and then in the third case, maybe they would produce the spider not in a glass, but kind of just put it on the table and let it kind of walk around, or maybe in the glass but really, really close to the person. And again, bit by bit, the feelings of anxiety kind of gradually reduce. as a result. So that's the behavioural aspects, the kind of systematic desensitization, the graded exposure, and the cognitive elements was kind of like understanding that thoughts can be irrational, and trying to understand if you're having a thought about I'm rubbish, I burnt a bit of toast, and then internalizing it's my fault, I'm rubbish, and then globalizing I'm rubbish about everything. You can kind of mitigate some of the problematic symptoms by challenging those, understanding those are not rational thoughts, they are irrational, and reconstructing it, so kind of like cognitive reconstruction. So that's the idea behind CBT. There are other kind of theories. This is Maslow's hierarchy of needs. He basically believed that there was homeostatic kind of physiological levels. There was safety, there was like belonging, and then basically once you get everything you need in terms of safety and physiological needs, once you identify your food source, your water source, you're safe, then you can think about love and belonging. Then you can think about self-esteem, and then there's a thing called self-actualization, which is this higher level apparently need. And now we get into ACT, which gets a bit more interesting. So I just want to kind of explain the differences between like CBT. So CBT is like a second wave therapy, whereas they call ACT a third wave CBT therapy, basically. So it's a newer wave therapy, and it differs in the sense that it's not about mental reconstruction. It's about openness. It's about openness to pain. It's about identifying values and kind of uses mindfulness here and now. Anyway, I'll go into some of those things in a second. Here's the hexaflex. So I mentioned contact with the present moment right on top of the hexaflex. That's basically mindfulness. It should be in the here and now. So rather than worrying about things that haven't happened yet, or kind of ruminating about, you know, something that happened in the past that went badly, you basically try to focus on the here and now. You accept your experiences. You're open to your thoughts. So if you have thoughts that are telling you, oh, you're rubbish, you can't do this, you're a failure, you just be open to it. Just acknowledge them. Just acknowledge those thoughts. Then there's something called cognitive diffusion. That's a kind of like like being an observer to your thoughts. Kind of I'll give you an example of a cognitive diffusion exercise where you basically see a thought and you put it on a leaf and you kind of visualize it going down a stream. So you kind of see thoughts as just thoughts. They're not you. They're not necessarily have to command you, or they're not necessarily true. They're just thoughts. Thoughts are just thoughts, and it gives you a little bit of distance between you and your thoughts, and it can be very, very effective when you've got negative thoughts. Values are very, very important. So one of the very first things you kind of do with kind of ACT-based therapies is perhaps identify important values. Values can be things like, I want to be fit, I want to be educated, I want to be a kinder person, I want intimacy, I want love in life, I want to be a generous person, I want to have good family relationships. You have specific domains, and then you can identify, you know, maybe specific goals within those domains. So if your value was I want to be healthy, perhaps achievable goals are things like, okay, I'm going to go to the gym 3 times a week. So you can't tick off a value. It's something you keep on working towards, but you can tick off goals, i.e. I want to go to the gym. That's my goals, 3 times a week. Have I done it this week? Yes, I have. Tick. So that's the crucial difference. Committed action is, it's really, really, really difficult to really difficult to kind of commit to values and commit to everything. And anyone who's kind of like developed New Year's resolutions knows, you know, you don't stick to your dietary plans, you don't stick to your exercise plans. We kind of do things, we don't have time, and we give up. So what committed action is about, it's kind of identifying, you know, we're not perfect. It's about identifying these things. But when we fail, don't punish ourselves. Just kind of get back on the bike kind of thing, and go back and keep on working towards your valued behavior. So you can start your kind of commitment to values quite small, and then slowly develop it as you get better and better at commitment. So commitment, it sounds something really, really straightforward. I'll just commit to your values, but it's actually a really, really difficult thing to do, and it takes a lot of practice. All of these things take a lot of practice. Mindfulness is extremely difficult. Just when you start mindfulness, you basically will lie back, or if you want to do like a breathing exercise, it's one of the very most basic exercises, is just focus on your breathing. You'll just see your mind wandering around, and that's entirely normal. And you try to center your mind on the present moment and on your breaths, and you just see your mind just zooming off again. And the idea is you don't judge your thoughts, you don't judge the fact that your mind's wandering, you just kind of quietly bring it back to your breath. So it's very, very difficult to achieve. And then something called self as context. Is this a process? I think that's debatable, but self as context is a kind of a journey. It identifies a journey from something called self as content, where you are your thoughts, you believe in your thoughts, and your thoughts direct your behavior. So if you're having a thought of I'm rubbish, you might not do something because you feel you're rubbish. I always fail, I can't do this. You might never go to university because you feel like you'll fail your degree. So self as content is can be very, very negative. If you have these negative thoughts built in, is the believing, the literal sense of meaning of your thoughts. Whereas self as process, because there's three key processes in this, self as process is the kind of observing of your thoughts, just seeing them in a non-judgmental way. And there's a self as context, which is something even further, where you're basically completely detached from your thoughts. You can see thoughts as just thoughts. You don't have to engage in any kind of cognitive diffusion. You are separate to your thoughts. So we're trying to achieve something called self as context, and that gives you that healthy kind of observer. You're separated, a slight separation between you and your thoughts, and that can be very, very healthy. It's shown to be very, very effectuous in multiple randomized controlled trials. Anyway, so being present, cognitive diffusion, acceptance, values, commitment, and self as context are the key processes of the Hexaflex. They all lead to something called psychological flexibility. So engaging in these 6 key processes leads to greater psychological flexibility. So the idea is this: we all get these negative thoughts from time to time. I can't do this. It's a waste of time. It won't work. I'm too thin. It's not for me, I don't deserve it, it's too hard, I'm embarrassed, I'm too fat. We all have these kind of negative thoughts. We'd like to turn thoughts off as easy as it is to turn a light switch off. That's just unrealistic. Thoughts are really difficult to just turn off. We'd like to fix thoughts if possible. We'd like to be able to mend thoughts, change thoughts, alter thoughts. But again, it's very, very difficult. That's what CBT tries to do, and it's unless you with a trained practitioner, it can be very, very difficult. Our kind of own ways of trying to suppress thoughts are really, really dangerous. So if we try to squash or suppress a thought, there's a whole bunch of literature that says that the more you do that, the worse it actually becomes. The more prevalent the thoughts are, and you basically just you're using a lot of your energy just to push these thoughts down. So thought suppression doesn't work. It makes the thoughts much more frequent and stronger in the long term. ACT is all about, it has tons and tons of metaphors. One of the metaphors is the sinking sand metaphor. The idea behind this is the kind of more you struggle, the more you sink. So don't stop struggling with thoughts. Hence the openness, the acceptance in ACT. One of the key principles in the Hexaflex was the acceptance. And that's rather than struggling, just be open to negative thoughts and experiences. So don't we spend a lot of our time fighting or struggling with thoughts, playing tug of warring with our thoughts. Well, if we're doing that, we're basically disengaging with life. So you think how little time, how much effort that person's putting into that tug of war on the left hand side with the monster. The monster represents the negative thoughts, by the way. So the more you struggle, the more you're not engaging in meaningful life behaviors, and that's really, really dangerous, in terms of your mental health, because if you don't live towards the things that are important and meaningful, then the problem is you might start becoming depressed, anxious, and just disengaged with life in general. So the engagement with life is really, really important. So the more you struggle and tug of war with the monster, the less you're engaging with life itself. So try to change the relation. This is a very important concept in ACT, is try to change the relation with your demons, your thoughts, and if you can't get rid of them, learn to live with them. So again, this is another exercise in terms of acceptance. Another one is the chessboard metaphor, where you see the kind of the white and the black pieces kind of fighting it out. Well, the idea is you think of yourself as the chessboard itself, not the battle. There's always going to be a battle on the chessboard. You're not the good thoughts or the bad thoughts. You're the chessboard. You're the context in which the pieces play. Yeah. So I mentioned cognitive diffusion. Very, very good exercise in terms of getting you to see thoughts as just thoughts and float down the stream. I mentioned mindfulness. The idea is, are you mindful or mindful? So if you're kind of not in the present moment, if you're in the future, worrying about future things or things in the past, your mind is just basically full of garbage and you're worrying about things you probably don't need to worry about, or ruminating and just causing yourself harm and suffering. There's no need for it. So be in the here and now, be present, and you can be like that person on the right hand side who's present and is mindful as opposed to full in the mind. And again, that's a very difficult exercise, but you just learn over time mindfulness practices. There's another kind of thing in terms of a metaphor in terms of relation to kind of thinking about your life and traveling through life, and the idea here is you're the bus driver. On the bus are also your good thoughts and your bad thoughts, and you're taking them all with you on your journey. So the passengers might say, you will fail, you're unworthy, you can't do this. They represent your fears, your insecurities, and all the bad stuff, that might put you off. So rather than trying to kick them off the bus and waste time, you basically just accept that they're there and you take them on the journey with you. So that's a really important thing in ACT. So you can decide in your bus of life which journey to take. Do you want to take the same old road? So same old road is the same old things, same old habits you've been doing, or do you want to work towards something that you value? Well, if you're not engaging in your values and it's causing you harm, suffering, and you want to identify, or you have identified new values which is more meaningful and purposeful to you, then perhaps you're going to choose that values-based road. But the values-based road, don't get me wrong, it can be scary, it's something new, so it's not necessarily going to be an easy ride, at least initially. It's like, sometimes the same old road, at least it's predictable. So maybe it might be completely not a meaningful and satisfying life, but at least it's predictable. So for instance, if you were, working in retail or something, and you wanted to enhance your education, You might have thoughts about, oh no, I can't do a degree, I'm not good enough to do a degree. So you value an education, but your negative thoughts are causing you some kind of discomfort. So the idea is you work towards your values, you choose the road on the left there, the values-based road, not the same old road, because you want to work towards your education, your values of being educated. So despite the fact that there are these thoughts that are trying to pull you down and making you feel uncomfortable, you still work towards these positive values. So there's something called a choice point. The choice point basically in ACT is kind of, we can get hooked and we can work towards the things that we value, getting unhooked or hooked, and sometimes we can basically get hooked with these negative cycles of thoughts, and they become barriers. They get you stuck in life. This is the problem with language, is it can get you stuck when you start developing negative evaluations about yourself, and it prevents you to working towards your values. The reason why we want to work towards our values is because a more meaningful life is something that is more satisfying than a just doing something that you don't really care about. So it's not about being happy. It's not the pursuit of happiness. It's the pursuit of a valued based life. So I mentioned values versus goals. Values can be things like work, education, friends, family, health, intimacy, kindness, compassion, whatever it is. No one can tell you what your values are. Basically very, very personal to you. I want to be healthy. Goal could be go to the gym or eat, something healthy. Mentioned self as content, self as process, self as context. So again, we're trying to get to a situation of self as context. Self as content is where we believe our thoughts. Self as context is where we're kind of free of that, and we have that distance. We are no longer our thoughts, and we are diffused from our thoughts. Commitment to values. Setting realistic values are very, very important. So Harris 2009 says there are 4 steps to committed action. That's choose a domain in your life. That's high priority for change. Choose what value you wish to pursue in this domain. Develop goals that are guided by the values, and take action mindfully. So something called SMART they use, and I believe this comes from the business literature. I'm pretty sure I've seen SMART in the business literature, but they use it effectively in ACT, and it basically means, yes means make sure your goals are specific, measurable, attainable, realistic, and time bound. So SMART. It has to be realistic goals. There's no point saying I want to be the best person in the world, or an astronaut, or it's just it's very, very difficult. It's got to be something that is achievable, and you can measure the success of that. Something else that is kind of important is this whole thing about comfort and discomfort, and I kind of touched on this when I was talking about the bus of life, and whether you choose the same old road or the new direction. Basically, your comfort zone is a small little circle, and where the magic happens, where all the values are and all the good stuff is outside the comfort zone. So you might feel discomfort as you transit from your same old road to something that you find that you value, i.e. an education or health or family values. If you want to be closer to your family, you might open yourself up to all kinds of fear about, oh, they might hurt me, or maybe a relationship or something. You might basically open yourself to pain. One important thing in terms of ACT, it's about what you want your life to stand for. So that's a kind of a nice way of kind of identifying values in life, is what in your funeral, and the people were saying stories, the kind of final stories about you and what your life was about. What would you want those stories to be? how would you want people to remember you? So values are, you know, supposed to be kind of positive things that that we work to kind of enhance ourselves and make life more meaningful. Okay, so that is a 30-minute and 9-second ACT tutorial, very basic. I'll put up other sessions in terms of, I'm going to do a very simple thing in terms of maybe 5-10 minutes in terms of functional contextualism, a little bit about language and how we get stuck, and tie that into ACT and explain how ACT undermines this process of getting stuck. So this is not certainly a standalone session. It's going to link into a series of other sessions based on ACT. So I hope you liked that. Hope you enjoyed that very short introduction. Thank you so much.